So we're going to continue today working with back pain or discomfort, hip malfunctions, different things along those lines. And today I actually offer you with a test to see if you might have an issue with something. This is going to be one of your rotators of your hip. And the way to test this, and I will go ahead and tell you now, mine will not be great because I have not worked on this since my back injury in summer. We're going to lay on our back, make sure your hip stays flat, put one ankle on top of the other knee, and then let that drop. Now, ideally, without any pressure, it would go flat across. If I go to the other side, keep my hip down, that way you can see a different angle, letting that knee drop. Now, my left side does just, or my right side does just a little bit better than my left side, so that tells me that my left hip is a little bit tighter. So that could eventually lead to some discomfort in my hip and lower back. But a simple step we can take on this is first a lacrosse ball to help, or a baseball to help relieve some of the tissue, release some of the tissue. Is going to be the lacrosse ball. We're going to sit on it, but it's going to go right underneath that pelvic crest, top of the butt area. I have my knees bent, my feet on the floor, and I'm putting pressure back on it. Now, as I'm rolling, I'm not finding a whole lot of issues yet, but if I start to roll to the outside, I'll start to find a couple of knots in there. I would stay on that knot, rolling with it for a while. I mean, 30 seconds, a minute, maybe 2 minutes, just working around that knot until it releases. After you've spent time on both sides, you know, underneath that pelvic crest, then the simplest stretch, I'm going to show you two, and they're both along the same lines. We're going to sit down, we're going to cross our ankle over our other knee, keeping our chest up, our back flat, or our back neutral, and press that knee down, trying to get this parallel to the floor. Now once you're here, you can kind of explore a little bit. You can lean forward into it, lean over more towards your foot. Big thing though is as you lean over, I don't want you rounding your back because that's not actually accomplishing anything. We want to move at the hip. Make sure that we're moving in the hip, looking for that slack. So if you're looking from a different angle, here, back is flat, leaning over into that stretch, and I can feel it pulling at some of the tissue that needs to be released. And I would work with this, just like the lacrosse ball, for 1 to 2 minutes per side. If, after you've done it for a while, you feel comfortable moving ahead to a little bit harder variation, find you something that's kind of padded. I'm gonna use this weight bench. Lay my leg on there, trying to stay over my foot as best I can. And I can even move myself away from it just a little bit, bring myself closer again, not trying to roll my back. I want to keep that spine nice and neutral and move at the hip. As you go, you're going to feel a lot of pressure and stretching through the hip. If you feel pressure in your knees, then you need to go back and just work with that seated variation. There's a lot less pressure in the knees with the seated variation. Guys, I hope that helps. Thanks for watching. Let's keep up the good work.